Here we go. All right. Welcome, everyone. I see we have some attendees in our audience. Can you see the screen? Just give me a chat. Let me know. We're going to get started. I want to give a warm welcome to Faith Borkowsky, the founder of High Five Literacy, LLC. She is an internationally respected and sought-after literacy consultant and a certified dyslexia practitioner, an award-winning author, and a speaker. She is the author of the award-winning book, Failing Students or Failing Schools, A Parent's Guide to Reading Instruction and Intervention, and If Only What I Would Have Known. Series of books convinced as a roadmap for literacy, readiness, and success for parents for young children. Faith was a finalist for the World Literacy Foundation Award for her significant contributions to literacy. I am so glad you're here with us this evening. But before we get started, we do have another class coming up about how to speak to your Board of Education. And I wanted to point out Faith's other book, Failing Students or Failing Schools. I had gone through this book getting ready for prepping for the next class coming up, and I think it would be a good book to read if you're looking for tips to speak at your next board meeting about reading and literacy. But for this evening, we're going to talk about If Only I Would Have Known. And this book is like my journey through how we got Ella identified. And I'm really passionate about Child Find, which is identifying children early in the process of a child's education. And the Child Find, if I would have known back then what I know now, I believe the trajectory of my daughter's life would have, been different. And it wasn't. And so this had been a 10-year journey for us. And I posted a picture today because the picture of her was in preschool. And I think I remember talking to you about this. And the preschool teacher said she's having a hard time sounding out her letters. And I didn't know. So let's start there, Faith. I had set you up some questions early on. And let's talk about how this book impacts the age groups. We know we talked about pediatricians, the one that I passed out to the pediatrician here in Waterford, that having a pediatrician have this book will help guide themselves and parents through this process. So tell us a little bit about, because I also stated it's not only for just early on. You had somebody on your show, you were talking about adult dyslexics, right? So how would this book apply for parents with early on and then children that are maybe in upper middle school or maybe into college?
Yeah, well, first, Elise, thank you for having me. I so much appreciate this opportunity to chat with you. And, I've been doing this for a while, and I've been trying to get this message out. And the book really came after Failing Students or Failing Schools, that book that you were just talking about. And even before Failing Students or Failing Schools was Reading Intervention Behind School Walls, Why Your Child Continues to Struggle. And it was republished as Failing Students or Failing Schools. And after writing that book, I had a lot of parents say to me, "Boy, I loved your book. This was so helpful. If I only had this book years ago when my kids were first born, boy, could that have been a game changer." Because Failing Students of Failing Schools was really written once kids are in the elementary school system and they are struggling and they're in intervention and they just keep going on in intervention, like lifers, and I call them the lifers. They just seem to go from one grade to the next. And so I really wrote that book from my perspective as someone who was a classroom teacher and a reading specialist and a regional literacy coach and administrator, having gone through all of these different positions and meeting with parents, that I wanted parents to have a simple, accessible guidebook. Like, what would tell them, what is the reading process? What should they be looking for in this journey? Why aren't their kids getting out of intervention? Intervention is supposed to be something that closes a gap, and yet, it seems like they're always lagging behind. And obviously, some kids take longer than others, but the goal should always be that we're trying to close a gap and to try to catch them up. So after speaking to parents and after having many parents come to my office, and this is when I did in-person work, and they would watch and I would assess their children, and they would start learning what the process is. Some of them, and that's where the title came from, was almost like this cry, this wail of like, oh, if only I would have known, and if they had known, things could have been so much different. So I said, you know what, I could write the script for this. And so for the If Only I Would Have Known books, I decided to use characters rather than writing it as a memoir, and rather than just, telling people about my own experiences. I decided to do it as a graphic play. And I enlisted my friend, who's a graphic artist, my friend Sheryl Rosenstock Marcus, to be the illustrator. And I wrote this in 3 short plays that were then put together into a 3-in-1 edition that mostly parents get. But I wanted these books to be accessible as a conversation between parent and professional. So the first one is a book that is the pediatrician and the parent speaking to a pediatrician. The second book is a preschool teacher, which very well could be daycare. It doesn't matter, but it's someone who's going to work in some type of teaching role. And then the third one was a librarian. And these books were really meant to be read before parents went through this whole process in school, so that maybe they could prevent some of these problems. As you said, it could have been a lot different for you with your daughter. So getting back to your question about undiagnosed adult dyslexics, many of the parents who come to me have had their own struggles. Not all, not by a long shot, but there are. And usually it's one parent or maybe a family member who did struggle along the way. And what's interesting is once they start learning what they should start seeing at different milestones, they realize, hey, I had trouble with that. They just didn't have a label for it. And so they start seeing themselves when they come to me for their children. And so, in helping parents, often I'm helping parent and child. When I would tutor, I have parents sitting right alongside their children. And I'm teaching both, really, essentially, how to listen for the sounds in words, how to apply letters to sounds, how to break up words. And so, I think they start to realize their own journey in this. And they thought, I was just not school material, or I wasn't smart enough. But then they realize, oh, this has nothing to really do with it. It was really the way I was taught and how I processed sounds and language.
Right, right. And this book could use, even though it's geared towards preschool teachers, I would assume like any teacher could read this book, right? To to
a hundred
help with,
percent.
elementary school kids, upper middle school kids, right?
Yes.
Um,
So it's meant, so the ideal window, I just want to be clear, the ideal window would be parents with children from birth to 7. But anybody could get a nice foundation reading these books and understanding in a very simple and impactful way what the process is, starting from the very beginning. And certainly teachers could read this book. It doesn't have to be preschool teachers, but anyone who is involved with working with a child or communicates with a child, it would be helpful to know what this journey is, what the process of learning how to read and write looks like.
so what other components could you piggyback off this book, such as the dyscalculia or dyspraxia? We know we talk a lot about the dyslexia and the reading and literacy aspect, but what we do know, and the science shows, that reading and writing go hand in hand early on. And there's obviously controversy about schools taking out cursive handwriting, or should we bring back cursive handwriting, or it's important to know that reading and writing go hand in hand. So it's beneficial for parents to know that as well, right?
Oh, well, that's part of the book, and that's part of the story that these children, so it's about a mom with 3 children, and by the time she gets to her youngest child, she already has gone through this with the 2 older ones, seeing and learning and not getting answers, where by the 3rd child, she's doing things differently. Okay, that's the story. But as you said, there's comorbidity. So for those people listening, that's a big word, but essentially it means that these issues don't happen in a vacuum, okay? That it is not unusual for kids who struggle to read. They also struggle with handwriting. They also struggle with being able to pay attention in school. So ADD or ADHD often goes along with some reading issues, writing issues, sometimes math and movement and being able to be coordinated. There's this whole cycle of things. So it's very common for children to be in multiple interventions because it doesn't just happen by itself. So being aware that probably the speech and language issue is the primary one. That's the one that we hope that parents will start recognizing and sharing with doctors. Doctors should understand the connection with reading and speech and language, that's something you really want to get that early intervention for. But as they're going on with speech, it's not unusual to see these other problems arise as well.
Well, in my case, I was on an IEP most of my whole life, right? So I would have never known as a parent or becoming a parent that, oh, if I have, ADHD or dyslexia myself, I should probably keep an eye on my own child and make sure that they're screened, or do a child find, or ask, when you enroll them in school, or talk to your pediatrician, right? So that has to be a part of what I call the finding of child find, or becoming a part of that process of enrolling your child in school, is to identify that if you have it, that parents need to understand that that is, a need to know when you're having your own children, and that should be brought up with your pediatrician visits when you're early on as well, because that's an important part. Because we know that dyslexia is hereditary, and I don't have for certain, but if I was to guess, my dad had dyslexia,
Mm-hmm,
and
mm-hmm.
so that's how I think I got it. So through him.
And it's like I said, it's not uncommon, but there are children where you can point to a person. And just to be clear, there are those kids who look like they could be classified, but yet it's the teaching method in school that will take them in the wrong direction. And honestly, you couldn't tell the difference between the two. And here's what you should know, that intervention works the same whether there's a genetic component or not. For those kids with a classification of dyslexia, it might take longer, it might be more intensive than those kids who maybe were just taught incorrectly and just need to be retaught the code in a systematic, explicit way. They might need more repetitions, lots more practice overall. But essentially, intervention should work the same way in a structured approach. So you mentioned child find. One thing that would be nice, and I think would be very easy, is have a questionnaire. There should be some type of questionnaire where that comes up. Did anyone in your family struggle? Did you or your spouse or your partner or, the child's parent, did somebody along the way struggle? Well, whether it's a biological connection, directly or indirectly. Do you know anybody where this might have been an issue? And then have that conversation. And all of a sudden, that should trigger somebody to say, oh, well, you know what? We need to keep an eye on speech and language development, because that is connected to starting to read and starting to write. Someone should have that conversation. And who better than the pediatrician? Because that really is your first line of meeting with a professional. Right? That's
Right, right. And so, but that also carries on. I know here in Michigan, we have an early start program, which is like Mama and Me, and then it goes into pre three and pre four, and then kindergarten, junior kindergarten. So early education. And it also, for parents to understand when they get established with their pediatrician, that then the school will partake in that as well. You've established a connection with your pediatrician, you've had conversations, and hopefully pediatricians will start to come to understand that these things need to be a part of their early on screening. Hopefully they can take on that. I know there was a question here I asked about, do pediatricians have screeners for educational screening for them, or suggestions with their speech or OT? And then that should be another part of your parenting as you enroll your child in school, because we know that some kids go early as first year, second year, and then they get more structured in pre-3, pre-4, and then you have Head Start or GSRP. So with all of these, it's like you're adding pieces of your team. So you've identified yourself that you have something, you've had a dialogue with your pediatrician, you've talked with your pediatrician about what could be done. Hopefully, as the word gets out that pediatricians are coming online about learning disabilities that are what I would consider invisible. You would never know. She looks like a student, she acts like a student, but she's not performing like a student, right? And then you add the school team with that and building relationships so that your child can successfully get what they need early on, so that if they end up with an IEP or a 504, that those success conversations is what I call the team, right? Having a team of a great neuropsych or a therapist or a psychiatrist that you would need for that child's needs through their years as they transition from kindergarten through college or trade school, as they grow. So have you heard of any pediatricians or know of any pediatricians that have screeners that are, I would say, specific to reading and literacy, or have we not got to that point yet?
No, we're really not at that point. Now, that doesn't mean there aren't screeners out there. So Nadine Gabb, the Gabb Lab, they have been working on this screener. And there are, a couple of other screeners out there. But as far as a pediatrician using this and having it as part of their repertoire of, looking at general health, literacy health is not really on their radar. And so when I wrote this book, it was like the ideal situation that would happen, that if a parent could go to a professional, this is the conversation that we would hope for. If a parent could speak to a preschool teacher, ideally the teacher would know, what would help. If a parent would go to a local library, this is the conversation you wish you could have with the children's librarian and the books that would be available to them. It's the ideal. So that this way they could learn in a very simple way, oh, so that's what I should be looking for. And, and I know professionals don't necessarily have the time to delve deeply into this. And parents with young children certainly don't have the time. So there are other books out there, but a lot of them are very heavy academic, deep reads. But as you know, since many of the parents themselves might have struggled, I wanted this to be something that was easy to understand. It's illustrated, it's in a play format, and they could identify with the characters, that they could see themselves actually having these conversations, and the professionals who work with those parents would be able to then understand what's going on here. So I don't think we're there yet, but I think that's the next wave. I do think there will be more doctors getting on board, but my hope is that these types of books can sit in those offices, in pediatric offices, in maternity wards, they could be gifts for, baby showers, so that parents start to learn early on, and these professionals start to have those conversations at a time when we could prevent a lot of problems.
Early on, for sure.
Yeah.
I love the fact that you use the two words literacy health, and that would be a really great idea to take the book and put some highlights into a PDF that can make into a poster that you could post onto the pediatrician's office, or put that in with the book so that they can hang something like that. Like that could be a whole nother class within itself about literacy health early on, and creating that team so that the pediatrician knows what to look for and identify. You mentioned Dr. Nadine Gabb, which I've read some of her research. What do you think about, as you say, it's almost like parents, as a special myself as a special education advocate, right? I'm a lay advocate. I'm not an attorney, but I am passionate about, the IDEA and how they can help our children. So, it, as you say, parents are busy, they work. Most parents don't have time to sit and read one of those heavy books, or sit and read the IDEA law codes, or sit and to try and track if there was a violation made. And, obviously Peter Wright has a book, Emotions to Advocacy, which is a great book to read if you have a child with a 504 and IEP. Where would you think to send a parent in simple terms to find, a checklist of, we've identified now through the pediatrician's office, we're able to know that if we have it, then possibly our children have it. And simple like websites or places to go for a parent to try to have a quick checklist. What am I looking for? Or a checklist for parent teacher conferences, something that they could talk and have dialogue with their teachers and their child's school.
Yeah, so there are checklists out there. If one were to look, there are those checklists out there, and that's great to bring it to the school. For my goal was, I wanted parents to really feel the story. I wanted them to be able to understand it deeply enough to be able to ask the right questions, and for professionals to know enough to be able to respond. But as far as getting that checklist, because clearly parents should not be spending their time studying, the rights law books. It's unfair. It really is unfair. And then you have parents in, neighborhoods where they can't afford a parent advocate or an attorney who could do the talking for them. So we need to set up advocacy where parents could learn or be able to get volunteers who could assist them in this journey. But as far as having a checklist goes, if you were to look on certain websites, such as IDA, the IDA website will have those different quick checklists, those types of handouts. And, a lot of times, because parents don't know yet, they don't look. That's the whole point, that they look at these checklists after they're already in school, after their kids are already in second, third, fourth grade. Then they start looking at checklists. So I don't think parents know early on to go grab a checklist. That's why I wrote the book, because the checklists are fine, but I think parents just expect the schools to teach. They send their kids hopefully fed and bathed and clothed, and that's enough. Like, what do you want from me? How much more do I have to do here? So then it's not on their radar. And that's why I was hoping that with these books, it would be something that's shared widely in professional organizations and community organizations, and having conversations around these books. These books were actually used in a book club format. And on my website, ifonlybooks.com, that's where anyone could find information about the books, ifonlybooks.com. I have a guide, a discussion guide for the books, for each book, books 1, 2, and 3, that if anybody wants to lead a conversation around these books, they could. And this would be great at community organization meetings, parent meetings. So that's on the website.
I'm glad that you mentioned the IDA, because each state has their own local chapter. So if anybody is in the audience that is connected to the IDA, that this could be a talking point in one of their meetings, and they could host a class or a book club with that to share with their local community chapter in each state, which is a really good idea. I will check that piece of that out. Now, what other characteristic challenges in common societal norms and expectations through your characters of this book? How would that reflect those societal pieces?
So I think the characters were written based on real students I've had, bits and pieces of students I've had. And also, the idea of it being in a family, where I've worked with parents where one child had some problems and then the other child has a different set of problems, but it all boils down to language-based difficulties. That's the underlying area of concern, but they manifest in different ways. So this was from my experience working with kids in intervention, working with teachers, just being a coach and a trainer, that these are the types of things I've encountered. So when I came up with these characters, they're little animal characters. And I did that on purpose. I didn't want it to be a kid who's white or black. or Hispanic or Asian. I wanted it to be so neutral that any parent could look and see themselves and see their own children in this. So that was done on purpose. And then the types of things that I've seen, I talked about little problems that they've had, whether it's holding a pencil, or they say the sounds in the wrong order in a word, or a sentence will come out and the words are in the wrong order. It's it's a problem with syntax. So all of these types of things I've seen myself as an interventionist, and they are in the book. So when you talk about common, like the norms, this is over years and years, Elise, of seeing students who have had multiple issues and struggles. And like I said, most kids who have had reading problems often have had handwriting issues. And those same kids who've had handwriting issues also have trouble with focusing issues. So, and it doesn't mean it will all be the same, but there are these common traits that come up. And so I tried in the 3 children to present a different picture, even though they all point to a language-based problem.
So when you spoke about the pieces of comorbidities, right? When did you start seeing, and how did that play out in the book with addressing the emotional aspects of the child feeling like stupid, or I can't do it, or the teacher calls home and said, well, she's just not reading and in quiet time? And how do these emotional aspects, and maybe you can see them early on, pre-3, pre-4 with behaviors.
Yeah.
How does that work with these?
Right. Well, you could look at a child before they start school. And honestly, before they start school, that emotional component is not really going to be apparent. Other things could be apparent before they start school, but it's the anxiety of going to school and not being able to get it that starts this ride for them, right? So, and that could be as young as kindergarten, where once they start learning how to read, there are some children who recognize others are doing it, but they have trouble. And I've had kids as young as 5 years old starting to feel, anxious, starting to feel different. Their self-esteem starts to suffer even early on. Now, there are other kids where they didn't feel it at that point. It appeared to those kids and their parents that they were doing just fine, because if they were in level books, perhaps they were able to get through the books and be able to read the books. And we know what that means, being able to use, let's say, the pictures and the predictable, repetitive text to get through the book. And for the parent and the child, maybe they really did think, oh, they're on the road to reading. And only once the words started to get harder and the pictures are not in the books anymore and things started to change, did everyone start realizing, including the child, that, oh, you know what, I am different. I'm really not doing as well as I thought. So, there's no marker for the emotional piece, but I will say that that is one part of this that usually doesn't present itself until they start school, right? And so I do talk about that with the older children. Remember, it's about a family of 3 children, a mom with 3 children. And so some of the older ones could have experienced that. The youngest one rather, not yet. But she knows enough that she doesn't want that to happen because she sees that the other ones are struggling emotionally. So, I think it's a really good question. I take mental health very seriously. And it's not unusual for kids who go through intervention to go see a therapist. I would say over the years, most of my students I've seen who need this type of help, they definitely talk to someone or need eventually to talk to someone like a psychologist or a therapist.
Which I think, along with the book, having this type of book with your pediatrician and your librarian, where they're getting the word out, and the pediatrician comes to understand that there's a link to the mental health aspect of it. That's another layer of the education by providing this book to your clinician and letting them know that it's important to take the whole aspect of it, those suicidal aspects, the mental health aspects, the self-esteem, all of that, and have the pediatrician to come to understand that this is a whole big thing that needs to be looked at, not just the child can't read or write or it's hereditary. How do we support that family? I think it should be noted that it's the awareness and then all the components that come with the awareness along with it, which is overwhelming and just sometimes unexpected to families. And they're still working hard and struggling to still get what their child needs because they haven't been identified. And a lot of pediatricians don't really know how to help, which is it's concerning and sad, to be honest. And I'm glad I'm at the end of the journey, but I'm also glad that I'm able to bring more advocacy and awareness to it, because I don't want things to happen to anybody else like they had with myself and other people's children that I know that are going through all of the struggles.
It's
Yeah.
interesting. I think a lot of pediatricians feel right now the way our health insurance is set up, that they feel they have to see more patients to be able to make up the money that they were losing. And I've heard this. So this is not just me saying this. This was something I've heard where, they feel they have to get in more patients in the day because of how insurance works. And I had a pediatrician say to me, I don't have time for this. I can't do this because I just have to see X number of patients, and I can't imagine even having that conversation. I don't have time for that. And so I said, would you have time to point out if there were problems with someone's lungs? Would you have time to point out if it was a child's heart? Or, and that makes them stop. Like, this is part of a healthy child. And I don't think they get that this is part of the health picture, that when there's an organ failure, it's a lot easier to say, oh, no, of course I wouldn't ignore that. I would never overlook that, when there's that physical problem. But something like this, they don't really see it as their job. And we have to change that. That's kind of something that conversation needs to change a bit.
Well, I think you bring up that good point, and I think there's a lot of information, and people would even venture to say that dyslexia is so-called the invisible disability, right? So unless you have a child that has that invisible disability that has really great superpowers, and we want to look at all the great things they have, but we don't want to look at the dark side of it, or the fact that the child doesn't look different in a way, or they're not in a wheelchair, right? So I guess that's a good point, that pediatricians, as you say, like that they didn't have time, that they have to, bill their insurance company. But then, 3 years, 4 years down the road, they're in the pediatrician's office looking for a psychiatrist because they need help. And then they're placed on, self-esteem medication because
Mhm.
they don't have a physical looking appearance disability, but yet they can't get out of bed and the self-esteem is in the gutter and probably bullied at school, which is a really good point that I think we need to keep the words that you used, literacy health, um, with invisible disabilities, to bring more light and shed more light onto those topics so that pediatricians, and I would venture to say not just pediatricians, right? Anybody who's involved in the child's life,
Yeah.
that they need that kind of understanding that this truly is she looks like a student, she acts like a student, she's not performing like a student. And let's face it, these dyslexic kids are pretty smart and they do tend to keep themselves low to the radar because they don't want to be noticed what they're going through, or Faith is a better reader than me and she's an AP student and I'm not, and she's going to go to a big university and I won't. So that stigma, it continues to grow bigger and bigger and bigger as the child gets older, right? It's like if they're not identified and they don't have that support or they don't have the family support at home, that it grows and it becomes worse.
Yeah. So I do want to say, Elise, so you mentioned the word invisible. My goal is to make it transparent. So the book is meant to shed light on something because it's really not as invisible if you know what to look for, right?
Right.
It's
Yep.
the issue really is it appears to be invisible because, people don't know what to look for. And the way the schools traditionally have taught kids with books that mask the problems, that it's not apparent to even the classroom teacher. So if let's say children were reading a leveled book where they had the predictable text and the pictures, and they seem to be reading the book, well, then it's an invisible problem. But then put those kids in, let's say, something that's decodable, and they can't crack the code, right? And they're being taught the code explicitly, and they're still having problems cracking the code. Well, now it's obvious. Now we're making it transparent. So the whole goal of the book is to shed light and to make this transparent to just about anyone who deals with the child so that it's not invisible, because there are those obvious signs early on. So if a child struggles in speech and language, there is definitely a very good chance that child is going to struggle when they start to learn to read and write. And, if parents just knew that, and teachers were aware that, oh yeah, this was a late talker, or this child had articulation issues, oh, and this child had tubes in his ears, or whatever the case may be, that could set them back from being able to hear phonemes in words and to be able to associate letters and sounds. We could catch these kids much earlier and give them that second dose, give them that ability to be able to practice a little bit more. We could change the trajectory for those kids.
Right. And that's to mention to early intervention. And so that a more a parent knows, the better off success that child will have as they grow into it, right? Um, so I wanted to see if there's any questions. Where are we with timing? Any questions from the audience? You can chime in and ask your questions in the chat box. Faith, what else would you like to highlight about the book this evening as we're winding down our conversation?
Yeah, so I do want to bring attention to the website. So on the website, there is a free workbook called Can You See Me? And I left it on the website where parents and professionals, they don't even have to put in an email. And I did that purposely. Sometimes you see something and you're like, I don't want to give my email again. I'm so tired of giving people my email. Then they bother me with all these messages. I'm not asking for anything. It is up there and it's called Can You See Me? And it is a little workbook that communities can use to be able to have conversations about child find, recognizing a child early on. And it's illustrated as well. And it goes from the child who is this sweet little kitten into growing into a roaring lion. And obviously, it didn't happen overnight. It's grade by grade of this internal struggle of people seeing this child and not understanding the child and understanding the problems that's really right in front of them. Like you said, that it's invisible. That workbook is a great conversation piece for a PTA meeting, for school districts, for community meetings. And the workbook is set up to be meeting after 1 month of talking about this, after 3 months, 6 months, 12 months. And it's a great companion to the If Only books. And so it's on that website. That is for free, as well as the discussion guide for the books. So there's a lot right on that website. So I would encourage people to go to ifonlybooks.com. They will learn about each one of the books. My recommendation is for a parent that they would get the 3-in-1, the purple book, which is, for all the books put together. That would be a great parent one. And for the parents where English is not the first language, it's in Spanish too. So this could be in communities where you want to bring parents in and they could read this in their own language and feel comfortable enough to ask questions. I would recommend the Spanish version of that. The individual books, I feel, are best given as gifts, like, giving it to your pediatrician to sit in the office, giving it to a preschool teacher, giving it to a librarian. And that's why they're written separately, and then the 3-in-1.
Great. So we'll continue our hashtag. We'd like to see those that did purchase the book. Faith has given a great discount through Amazon through the holidays. The elves have the discount, so you can visit the Amazon for her books and pass one out to your pediatrician. Take a selfie and give it, put it up on our site. If only I would have known hashtag. So we talked a lot about early on, Faith. What can you discuss about upper ed, or do you in your practice through these types of books that you're using and you're out in the field, are you doing any work with adults or prison to pipeline?
So that's interesting. In my private practice, I do have older students. I work with students. I have a college student right now that I'm working with. So, I do that. Do I do that type of work? No, I really haven't been involved with that too much. I have spoken to communities about the importance of recognizing adolescent literacy and difficulties with adolescent literacy and adult literacy. As a matter of fact, I talk about the books, the Word Wasp books. You probably have seen me mention The Hornet and the Word Wasp. Those books are great for tutors who do not have like Orton Gillingham training or any type of specialized training, where a parent without any training, a tutor who's not certified, or any volunteer could use those books, the Word Wasp and the Hornet, and help a student, an older student, or an adult to turn things around for them. Because the truth is, Elise, we don't have all these licensed professionals to do the work that needs to be done. That doesn't mean there aren't inexpensive, effective tools out there. So for anybody who is interested in working with students like this, and they'd like to do this, but feel, well, I don't have OG certification and I don't have any type of reading degree license, I have a Facebook group, and it's called Word Wasp USA Support. And I welcome people to join me. And, if they want to try these books out, the coaching pages are embedded right in the book. And then in the Facebook group, we answer questions and we help people along. So, and the books are really inexpensive. So, like the Word Wasp, I don't recall how much it is, but like the Hornet might be about $30 American dollars. And the Word Wasp, I think, is probably 40 something dollars. I'm not even sure. But the point is that people are using it. I actually interviewed a parent on my Facebook Live, and anybody could find it, who's successfully helping her child after the school district, after years and years of intervention, could not do this work. And she's helping her daughter read, a teenager.
So I saw that video. It was a great video and a really good story. So would you recommend those that are homeschooling as well to be a part of their homeschool, or
100%.
that would
100%.
be beneficial?
Yeah, are you kidding? They could easily use those books. So the books are fabulous for spelling as well as decoding. And there are homeschool parents who pull their kids out of school because they are struggling readers. That would be ideal for them. And especially if they're homeschooling, they might not have this budget to be able to, afford these very expensive programs with lots of materials. You don't need a lot of materials. I've even said about my own teaching, give me a board and a piece of chalk, and I could show a kid how to read, really. And so we're fooled into thinking you need a lot of materials and a lot of things to do this, and a lot of moving parts. That's just not true. And so anybody who does want to work with older kids, I welcome you into the group. And if they want to get those books, they could find that at wordwasp.com. And the books are on Amazon.com as well. But from what I heard from some parents, the British version sometimes is sold instead of the American version. So you have to be really careful with Amazon that you're getting the appropriate version that you want. And so I would probably look at the website, know what you're getting. There's a suitability assessment on that website as well. And so this way they would know, oh, should I start with the Hornet or start with Word Wasp? So, and that could really help these teenagers. So you talk about the pipeline, right? We could still help high school students. We could still help these older kids. It's not a lost cause by any stretch. And this is an affordable way to do it.
I'm glad you shared that with us too, that other aspect. Although we want to try to capture early on, we still see a lot of upper ed struggling. I mean, obviously with the national rates and the state rates here in Michigan. So yeah, I appreciate you sharing that. And I want to thank everyone for attending this webinar. And Faith, thank you for joining us and talking to us about your If I Only Would Have Known. I appreciate your time and your help and all of your ideas. You can find Faith's information on her website, and we'll place it on our Facebook page. All of the links that she was talking about, you can find it here in the chat box as well. If you have any questions, then reach out to us via Our Dyslexic Children. We'll answer questions there. And be sure to buy the book. Faith has given us a generous discount. Send it off to your pediatrician for a Christmas gift. That would be great. And the Word WASP group, I will post that as well. And you can join in for those talks and discussions and supports that Faith has to offer. We appreciate everyone joining us. Faith, thank you so much. I appreciate your time, and I'll see you.
Yeah, and one more, and my own website, high5literacy.com. So if anybody wants to reach out to me, about anything, they could go to high5literacy.com. That's my general website for information about the work that I do. So I just wanted to add that in too.
Great, thank you.
Okay.
All right, everybody, have a great evening, and we'll see you in the next class. Remember, I talked about her failing schools, or failing students, failing schools. This will piggyback off our next upcoming class about speaking at the board. I had earmarked a couple of pages, so look for that book as well. We'll have other recommendations on our Facebook page, and you all have a great evening. Thank you.
Thanks, Elise.
Absolutely. Take care, everybody.